Welcome back. Well, it is a term that our next guest says causes quite a bit of confusion in his field of expertise. Joining us once again is Dr. Matthew Nawrocki. He is a prosthodontist with Jacksonville Dental Specialists. He's joining us to talk a little bit about cosmetic dentistry. What's that means, what kind of training goes into it, and why you say there's a lot of confusion in your field.
There is. It's often a misconstrued, or it's a misunderstood field. There's the belief, or there's the portrayals by a lot of dentists and general dentists that it's as if it's a specialty. It's that there's certain dentists that are cosmetic dentists and certain ones that are not. Every dentist should be concerned about aesthetics. Things should look and feel natural and should look nice and pretty. But the understanding of it being a specialty field is incorrect. The field of cosmetic dentistry falls under the guise, according to the American Dental Association, of a prosthodontist. There is no subspecialty of cosmetic dentistry like you have periodontists and prosthodontists. And so it's kind of a misnomer. It's kind of, really what it is it's almost a marketing gimmick, so to speak.
So what kind of training would you say that consumers should be looking for to make sure if they want to go down this road, they're getting good treatment?
Are you seeing, so the first thing is, who are you seeing? Are you seeing a general dentist who is portraying themselves as being this specialty, quote, cosmetic dentistry? Or are you seeing a specialist? Specialty training, certainly the field of prosthodontics, amongst all the things we learn, are aesthetics, cosmetics. How does the different materials play and role in that? Developing something that fits in harmony with your biology, that begets aesthetics. So you want to ask first, are they a specialist or are they a general dentist? If they're a general dentist, they've relied on continuing ed weekend courses, whereas a prosthodontist, we've spent years of formal recognized training to develop these techniques, to develop an understanding of the different aspects to cosmetics and aesthetics and how all the different materials and situations play a role in that. The next thing you should be concerned about is this a team approach? Is this, or is it one person trying to do everything? There's so much more to aesthetics than just the tooth, just the white. It's the pink part, it's the white part, it's how everything comes together. And so if you're seeing true specialists, we oftentimes work as a collaborative effort. So you will end up getting a much generally longer term, more healthy, strong thing. And then that also begets, generally speaking, better aesthetics. So much of what we do is driving function and aesthetics where they meet together.
Do you find that people go through your office who have had experiences that were not favorable in the past, and then you have to go back and then
Absolutely.
fix that?
Currently treating a handful, about 50% of what we do now is correcting a lot of these mistakes or a lot of these things where maybe some general dentists got in over head, or maybe the right protocol and team approach wasn't taken, and unfortunately it leads these patients down a very regressive path to where if it was done right the first time, maybe it was still going to be a few months or 6 months or so, but now we've got examples where these patients are 4 or 5 years into it, and it's going to take a good year or two just to correct the mistakes. And so if the case is planned well, if the training and expertise is there, and you're seeing formal specialists that are recognized by the ADA, the American Dental Association, oftentimes you're going to, by the nature of that, get a much more aesthetic result, and certainly healthier, stronger, longer term.
Okay. You have a seminar coming up. You say that people can ask all kinds of questions about this or whatever and just kind of pick your brain.
Absolutely. And so it's a wonderful option for those people who are interested in seeing what their tooth replacement options. Maybe you're missing all your teeth, some teeth, or think you might. So our next one is Wednesday, March 21st at 6:30 p.m. Please call, because seating is limited, and schedule your seat, or you can go straight to a consultation if you already kind of know your situation a little more in depth.
Good deal. Good to see you, Dr.
Thank
Nawrocki.
you.
Appreciate you as always coming in. I want to give some information there on your screen for those people who might be watching. 904-406, or I should say 460-4201 to schedule an appointment, or you can go to their website, which is JacksonvilleDentalSpecialists.com.